Hello, my name is Alagapan, and I'm a postdoc at Georgia Tech. Today I'm going to be talking about using explainable AI to identify LFP markers of recovery in patients undergoing DBS for depression. First, some disclosures regarding the study. The study involves off-label use of Medtronic DBS electrodes and pulse raters, and provisional applications have been filed for the work presented here. Deep brain stimulation of subcallosal cingulate cortex was first demonstrated to be effective in treating patients with TRD about 15 years ago. The target has now been refined to a white matter bundle at the intersection of four main white matter tracks: the cingulum bundle, the forceps minor, the uncinate fasciculus, and frontostriatal fibers. Open-label studies have repeatedly shown effectiveness, but randomized sham-controlled trials have not yielded conclusive evidence. This is because there is considerable variability between patients. Some patients, like patient 1, respond early, while others, like patient 2, require longer and multiple dose adjustments. The current standard for determining dose adjustments are needed is using clinical trial rating scales like Hamilton Depression Rating Scale. But these scales are confounded by subjective biases and suffer from poor longitudinal invariance. That is, they do not measure the same construct over time. In addition, the scores from these scales do not respond immediately to intervention, making it hard to determine if dose adjustments were effective. Thus, an objective marker of symptoms that respond to DBS is necessary. And we have seen from previous studies that local field potential from SEC have shown beta band power to be correlated with short-term depressive symptoms. However, it is not clear if these changes are observed at the time scales when sustained recovery happens in patients undergoing DBS. This happens anywhere between about 10 weeks to about 6 months. So, we need to answer this question, we collected LFP weekly from 6 participants undergoing SEC DBS over a period of 24 weeks using implanted IPGs with LFP acquisition capabilities. These devices were provided by Medtronic. During these visits, clinical rating scales were administered, and participants also had their clinical interviews with the study psychiatrist. These interviews were videotaped. As you can see here, during the first 4 weeks, 5 out of the 6 participants were still not responding and hence were considered to be in a sick state. At the end of the study, which is about weeks 21 to 24, the scores have fallen below the response threshold, which is derived from the scores assessed before the electrode implantation. And these participants are now considered to be in a well state. We first asked if there is any difference in SEC dynamics between the two states. The extracted features from the LFP recordings, including power and coherence in canonical frequency bands, and coupling between delta band phase and beta band amplitude. Using a neural network classifier on the LFP data from the 5 typical responders, we were able to distinguish LFP from the sick and well states, suggesting there is indeed a significant difference between them. You can see the classifier performance over here. To identify the features that contributed to the classifier's performance, we utilized a recently developed interpretable machine learning or explainable artificial intelligence technique called generative causal explainer. Briefly, the technique consists of projecting high-dimensional data into a low-dimensional latent space such that the high-dimensional data can be reconstructed. And importantly, changes in a subset of the components of the latent space changes the classifier output. These components were called the spectral discriminative components. And by reconstructing variations in the SDC, it is possible to see which features contributed to the classification. In this case, we used 1 discriminative component and 3 non-discriminative components to capture the variance in the data so that it can be reconstructed accurately. Using this approach, we found that changes in alpha and beta band contributed the most to the classifier's prediction. Importantly, it was an increase in beta band power in contrast to the decrease that has been previously reported in acute studies. So we decided to dig a little deeper by looking at the changes in the beta band relative to the week before stimulation was turned on. We found that the initial effect was a decrease in beta, but subsequently the beta band power increases. So this suggests that the effect of stimulation long term might actually be in opposition to what is seen in acute studies. Next, we tested if the SDC are meaningful behaviorally. We did this by comparing the SDC from the data that was not used in the training of the classifier and GCE. So that is data from weeks 5 to 20. And we compared this against Hamilton scores. We did not find any significant association. However, as mentioned before, these assessments are confounded by biases that make it hard to use them as ground truth. So we turned to the videos of the participants' clinical interviews and extracted facial expression features. We followed a procedure similar to the LFE features in that classifiers were trained with the sick and well state features, and the output of the classifier term facial expression state was extracted for weeks 5 to 20. When we tested the relation between SDC and facial expression state with the linear mix model, we found a significant association. This suggests that SDC does capture depression severity. Finally, we tested if SDC responded to our intervention by looking at changes in SDC relative to when stimulation voltage was increased. In contrast to HDRS, we see that increasing DBS dose pushes SDC towards well state, suggesting SDC do respond to DBS. In summary, I have shown you that the acute and long-term effect of DBS on SEC dynamics are in opposition to each other, suggesting there may be an adaptive process. In addition, I have shown you that SDC, which is derived from our XII technique, tracks depressive symptoms and responds to DBS. Thus, it may be used as a potential marker for informing SEC-DBS decisions. Future work will focus on replicating these results in a different cohort, followed by a prospective study of using SDC as a biomarker for SEC-DBS. I'd like to acknowledge the entire team working on this project. The people highlighted in orange have contributed significantly to the work presented. Thank you for your attention.